Hello, and thank you for accessing these videos on the bone and joint infection registry. I hope through these videos we can familiarize ourselves with the bone and joint infection registry. We can go through the process of data entry and troubleshoot any possible concerns, and we can also review the MDT software. So the bone and joint infection registry is available from the website BAJIR.org. To enter the registry, we select this page and access via an internet connection. We here have a live update of the number of confirmed infections that are currently in the registry. And then there are two options. If you do not have login details, then please select register, fill in the details as shown here, and your trust lead for BAJIR will confirm you as a delegate, and you will then receive your details. Once you have those details, please select login and give them here. So this is the home page of the live database. I'll show you what's available on this home page, and then we will go to the demo database so that we're not reviewing live patient data. So we have 4 tabs on this page. Download my data is not currently functioning at this time. Edit and enter data is where we access to upload a patient onto the registry. Access documents we will review. So here there are a number of forms. There are user manuals for the registry and also for the MDT software. And this will hopefully help troubleshoot any concerns that you may have during the process of data entry. There are also a number of paper forms which mirror the electronic version on the registry. This is optional and can be used as a process of live entry of the data onto a paper form by the surgical team, which can then be uploaded by the administration team at a later date. And these are constantly being updated as the electronic version does, so that the two are mirrors of each other. And they can all be downloaded from this page. We will also view our dashboard. So there are 2 dashboards. The first is for periprosthetic infections within your own trust. The second is the performance of your MDT, and we'll review that in the MDT video. But our dashboard of periprosthetic infection for this trust through this date range can be generated here. It does take a little bit of time to come through, but this is a live update of the number of periprosthetic infections that this trust has contributed, which is 83, and the overall number of PJIs within the registry. We can see how our trust performs compared to the other trusts that are contributing to the registry. We can see the number of cases within our trust over time, and we can look to see which joints are particularly involved. There is a chart here to show the microbiology isolates from our trust, and we can also review the number of reoperations broken down into different surgical procedures, as shown here, compared to the average across the trust. We can also view our patient-reported outcome scores. Again, this updates over time. We can see average EQ5D at presentation, and then at 6 months, 1 year, and 2 year time points. This is for DARE single stage, 1 of 2 stage, and we can see our average EQ5D score over time. So this gives a really helpful large amount of data to support your unit and the work that it is doing. So that's all I'm going to show you from the live registry, I'm going to log out, and the rest we will do from the demo registry. Go through the same login process, and we get to the same screen. So we've reviewed the documents and the dashboard, and now we will start entering data. So we can search for a patient within our trust by giving any of the demographic details shown here. Advisable to go via NHS number to ensure that the patient you would like to enter has not been previously entered for a previous procedure. The registry is color-coded, as you can see. A green patient is a patient whose minimum data set is complete. A yellow patient shows that the record is incomplete. There is some minimum data that's still required. If the patient was red, then that patient has deceased. This column here is important, registered infection. So up until the point that a patient has a registered infection, that data is only accessible within your trust. As soon as that patient has their infection confirmed, then they can be viewed centrally by the BAJIR admin team. We can then start the process of gaining their informed consent and sending out the PROM scores at follow-up. And we will show in this video how to ensure that the patient is confirmed as an infection if they meet the criteria. We have follow-up time shown in the columns towards the right. So if we will want to add a new patient, we can select the box there and fill in the demographic details that are given. Now, this screen is important. This data you cannot go back to and edit. So we need to ensure that this is accurate and it is complete, and all of this information has to be present before you can proceed. So it is important that this is done correctly. An NHS number is mandated in England and Wales, or a CHI number in Scotland. It's also advisable to add a local number as well, such as the local hospital number, and a date that that patient was referred to your service, either acutely or a different trust. Again, quick double check to make sure that all of this data is accurate, and if so, we can enter this patient onto the registry. So this takes us to this patient's record upon the registry, the date that they were referred to the service, and their age at referral. It is mandated to add the referrer. So we need to know the route of referral, which is mandated. These details are optional, but it is very helpful to give these details, because then if you want to contact the referrer with any outcomes from the MDT, all of the information is included. An email address and or a referral trust, which can be selected from this list. Referral location refers to the first part of the patient's postcode, and it's just the first 3 or 4 digits. This allows us to review any particular changes in microbiomes across the country as we go forward. And we can then say whether the patient was an inpatient or outpatient at time of their referral. Date of triage may well refer to be the same date as their date of referral to service. This date is not necessarily crucial that it is 100% accurate. And then we can add this patient's infection. So add, edit infected site, select and add new entry. Takes us through to the infected site page. Date of diagnosis. It's ideal to use the date of their microbiological diagnosis, which we can state here. And then we need to select whether this patient has an infected joint or an infected bone. If they have an infected joint, the options would be prosthetic joint infection or native joint septic arthritis. If it's an infected bone, fracture-related infection or native long bone osteomyelitis. It is also possible to include spinal infections such as discitis on the registry as well. For the first instance, we will go through the periprosthetic joint infection process, and then we will review the fracture-related infection as the surgical options are understandably different. So this patient has a periprosthetic joint infection. They did not have a sinus at the time of presentation, and it was an infection of their left hip. We can select here that this patient did have an implant present at the time of their index surgery. And we can also document whether this patient has had previous management, surgical management for infection. We suggest that rather than putting lots of retrospective data into the registry when you first start, just start prospectively, add the operation that you are considering for this patient. But if they've had previous surgeries, don't go in and give all of the details necessarily because it's quite time consuming, but you can signify here that the patient has had previous surgery and the number of previous surgeries they have had, and the last or the most recent surgery that they had can also be included. So this is a way of capturing those patients who have had multiple surgeries for infection rather than necessarily inputting all of the data for those individual surgeries that are retrospective. And we can also signify whether this patient has an acute or a chronic infection, and where you see the speech bubble with an information sign, there is some further evidence to try to guide how to answer that question. And for the purpose of chronicity, we've taken the 2018 consensus meeting and used 4 weeks as a fairly arbitrary figure, which we acknowledge. And then we have options about the current management, both surgical and microbiological. If you select yes, you must go across and provide further information with a date and this will take you through to a separate page for comprehensive data entry. So the surgery page for periprosthetic joint infection is shown here. This will obviously be different for fracture-related infection or osteomyelitis, and we will review that later. And hopefully this is a fairly comprehensive list of possible procedures. So I'm going to say that this patient had a single-stage revision of their periprosthetic joint infection. Once this is complete, select back to site to take you back to enter further data. Save and exit will take you back to the homepage of the Trust's registry. So we have added data for surgery, and that has gone green to signify that. We then have these further options which may or may not be relevant to your patient. If they are, then I'll show you the options that are present. Local medical management at surgery relate to local antibiotic delivery at the time of the surgical procedure. Again, a date must be included because if patients have had multiple surgeries listed here, we need to know which surgery this medical management relates to. And so for the local medical management, we have a comprehensive list of carriers, which we are adding to all the time, and also a comprehensive list of antibiotics that can be added to that carrier with a free text option if the antibiotic you've used is not represented here. So for argument's sake, we use Copal G and V cement, we use 10 mils of Stimulan, and we added vancomycin and gentamicin for this patient. Back to site. Again, the box turns green. There is an option for plastics procedures at the time of this surgery. Again, please add the date to signify which operation the plastics procedure is relevant to. This patient had a free flap, for example, of muscle, and it was a gracilis flap. So this can record any additional plastic surgery procedures that happened at the time. And then we come down to the sampling, both microbiology and histological sampling. The first is a joint aspirate. So this patient did have a joint aspirate a few days prior to their single stage revision. And we've hopefully included here a number of synovial biomarkers for infection, as well as the microbiological culture. And again, these may or may not be relevant within your trust. If you perform synovial white cell count, the absolute and differential numbers are represented here. If you use leukocytesterase strips, then again signify whether these were positive or negative. And again, there are values to add synovial CRP, calprotectin lateral flow, if that was performed, and again, whether that was positive or negative. And any other synovial tests that you may perform. We hope that this can be comprehensive and used for further research studies, but appreciate that not all of these are available in every trust. We also have the lab and lateral flow ELISA alpha defensin tests, which may or may not be used here. If they are, again, please signify whether they were negative or positive. And then we come down to the important microbiological culture. We can say that yes, it was sent for culture. Yes, there were organisms present, and we had one positive sample. And then we can add which infecting organism was present. And for this patient, we had a coagulase negative staphylococci. You can signify here if multiple organisms were grown within the same sample. Back to site. There is an option for histology, again, if that is performed in your trust. And the options here are just whether the histology is suggestive or diagnostic of infection. And again, that can be signified there. And then we go through to the microbiological tissue samples that were taken during this surgery. We can specify the number of samples that were taken, whether any were present, and the number of positive tissue samples. And again, just like the aspirate, we can specify which organisms were seen in the different samples. So we had a single CNS in 2 samples, and we had a CNS and an enterococcus, possibly a contaminant, as there is only one, in the 3rd sample. And we can go back to site. So that is all of the data entry at the time of the surgery. As specified earlier, there are paper forms for each of these options: the type of surgery performed, the local medical management, the plastics procedure, and the aspirate and the microbiology results. So this can be filled in real time in the operating theatre on paper, and then transcribed onto the registry at a later point. It doesn't matter how you do this process within your trust. We want to make it as user-friendly and as less time-consuming as possible. Below here, we have some other options which do not form part of the mandatory data set, but improve, excuse me, but do improve the quality of the data that is entered. So at follow-up, we can add any complications that the patient may have suffered. We do have a first line here, so whether infection is in remission. This is a question for each patient that will be repeated every 6 months, and you will receive prompts through the registry to review that patient and to confirm whether that patient is still in remission or not. Again, to really improve the accuracy of the outcome data that we can use for further research. So, is the infection in remission? Yes, no, or unknown. And whether any local complications were present, which gives a list of possible complications. For example, this patient has a wound hematoma. Blood tests can be added. It's a short list, and we have discussed possibly including other serum markers for infection. The date of the blood test and the result can be added here. Again, this can be used to monitor the patient's progress as you see fit. It may be useful to have baseline inflammatory markers and then a couple to chart that those inflammatory markers are returning to normal, but please use it as is most helpful to your practice. Systemic medical management refers to the systemic antibiotics. These can be oral or intravenous, and whichever option you choose provides a long list, comprehensive list of possible antibiotics, and also free text options if required. So this patient, for example, went on to ticaplanin and tazocin for 2 weeks was the intended treatment duration. And we can go back to site. It's very common for patients to change their antibiotic regimes during the course of treatment, and that can be signified here. So if we add a new entry, so this patient has now switched to an oral regime of doxycycline, if I can find it, for a further 4 weeks. That can be signified here. We can go back to site, and when we have changed, we can go back into our intravenous regime and give a stop date to really have an accurate picture of the antibiotics prescribed. Edit MDT will show any previous MDT discussions that a patient has had. They have not occurred yet for this patient as we've just added them, so there is nothing to see here. And finally, we've got follow-up or systemic complications to add at their follow-up. We can see whether the patient has been consented or not via the admin team at PROMS. We need to specify whether this patient is dead or alive. The PROM status is not seen in the live registry, so don't worry about that one. And then we can record any systemic complications that have occurred. We are linking to HES data from BAJIR at a regular basis. And so if any of this information is inaccurate, for example, a patient has died, then you will receive prompts to ensure that that data is updated upon the registry, again, to really ensure that we have high quality data to draw accurate conclusions from for research. Save and exit, and we go back to the patient. So James Smith has been added. We know it's a left hip infection, but you can see the box is still yellow to signify that this record is incomplete. And the box here is white. He is not a confirmed infection. So we need to add some more information. The first thing to do is to show a timeline, and this gives a really nice pictorial chart of the events that have occurred to Mr. Smith during the course of his infection. These are clickable, and if anything requires updating, we can click here and go through to the patient's record to update, and then we can go back to the timeline. The warning triangle here shows what data is missing. So we don't have a diagnosis, and we haven't confirmed that this patient is a infection. And I'll show you how to do that now. So we've gone back through to the patient record. All of the clinical data is here. At the bottom, you can see there is a next page. This takes us through to the very important page to confirm that this patient is an infection. Up until this point, the data that you have entered is only accessible and visible to the members, the delegates within your trust that have BAJIR access. The patient has to be confirmed as having an infection so that they are visible to the admin team in Northumbria. And so the process is then triggered for obtaining the patient's consent and obtaining their PROM scores at 6 months, 1 year, and 2 years follow-up. So we must confirm that this patient has a PJI. We need to confirm the date of their registry diagnosis, which we advise should be taken from the date of their microbiological diagnosis or when they meet the confirmation criteria as shown below. Currently, we have the IDSA definition and the MSIS definition from 2013. We're in discussion about including the European EBGIS definition as well. If we look at the IDSA definition, it's self-explanatory. This patient has 2 or more intraoperative cultures, therefore they have an infection. We can also review the MSIS definition. So this patient has, they did not have a sinus, but they did have a pathogen from 2 separate fluid samples. They had an elevated CRP, and we can signify whether their leukocyte count and percentage or leukocyte esterase was present here. But once complete, save and exit. James Smith now has a red box. He is a confirmed infection. He's visible via the admin team in BAJIR, and we can obtain his consent and PROMs. But his record is still yellow. There is still a little bit of mandatory data which is not present. The warning triangle here tells us that we haven't completed his comorbidity data. So if we go and do that here, open Mr. Smith's record, add edit comorbidity, add new entry, And we have a long list of comorbidities which we can specify here. Go through to the second page, and again complete the above, including BMI data. As I mentioned earlier, we are doing regular HES updates where we can identify any inaccuracies between the data on the registry and HES data for that patient. And if there are any inaccuracies, we will prompt the trust to ensure that the data is as accurate as possible. Once complete, save and exit. The record is green. He has a confirmed infection, and that is complete for this patient. Now, at this point, it's worth mentioning that it's possible to add a large amount of information to each patient. The process of data entry is often not able to be performed in a single sitting. You may enter the patient onto the registry with their surgical details, but have to go back in several weeks' time as their microbiological results become available and their antibiotics change to update that section of the registry. So I appreciate it can take some time. We acknowledge that, but it is essential to have all of this information to really ensure high quality data so that we can draw really accurate inferences from this data set through research. So we acknowledge that it can take a little bit of time. We feel it's very important, and thank you very much for joining the registry and going through the process to contribute to this national data set. Thank you.